Now I discuss case study on a patient with uterine prolapse. There are some patient history, and now I discuss the topic of uterine prolapse. There are introductions and anatomy and physiology of uterine prolapse, and next definition. Uterine prolapse definition is uterine prolapse is the downward displacement of uterus into the vaginal canal or a gradually descent of the uterus in the axis of the vagina, taking the vaginal wall with it. And there are types of genital prolapse, degree of uterine prolapse according to book and according to my patient. And etiology or high risk factors. There are some etiology, anatomical factors, predisposing factors, and aggravating factors, and pathophysiology of uterine prolapse. Sign and symptoms of uterine prolapse according to book, and diagnostic evaluation of uterine prolapse, management of uterine prolapse, preventive method, conservative method, and surgical methods. And there are patients physical assessment, and the end. Now the nursing diagnosis acute pain related to uterine descent, pelvic muscles stretching, and pressure on surrounding tissue secondary to uterine prolapse as evidenced by verbalizations and discomfort. There are replanning and interventions, and impaired urinary eliminations. And next, say day 2, physical assessment and nursing diagnosis, risk for infections, risk for skin integrity, and fluid volume deficit, and anticipatory grieving. Day 3, physical assessment. Day 3, nursing diagnosis, anxiety and disturbed sleeping pattern and knowledge deficit. There are complications and prognosis in day 1, day 2, day 3, and preventive method of uterine prolapse and discharge advice of the uterine prolapse. Thank you guys.